Ear infection treatment. Ear infections can be painful and really uncomfortable. But don't worry, they usually get better with the right care. Ear infections can be broadly categorized into three types, depending on where they happen. Infections of the outer ear are called otitis externa, the middle ear otitis media, and the inner ear otitis interna. Each type has its own causes and symptoms, requiring a tailored treatment for each. So, let's dive deeper into it for better understanding. 1. Middle ear infection, otitis media. Otitis media usually happens as a secondary infection to issues like cold, sinusitis and allergies. So, the treatment usually involves treating the root causes. In some cases, addressing the underlying issue alone may resolve the infection. However, if the infection lasts more than 5 days, doctors usually give antibiotics. These antibiotics are tailored to the specific bacteria involved. Surgery is usually not recommended for otitis media. However, if the infection keeps coming back, or is not responding to medical treatment, surgery might be needed. 2. Outer ear infections, otitis externa, or infection in the ear canal. For otitis externa, the treatment depends on the type of infection. This infection is broadly divided into two types, circumscribed and diffused. Circumscribed occurs in the outer part of the ear canal only, where hair follicles are present, and is confined to that region and does not spread. Whereas diffuse can occur in any part of the ear canal and spread to any other part of the canal. For circumscribed otitis externa, doctors prescribe antibiotics like amoxicillin or coamoxiclav. This needs a dermatologist consultation in addition to the ENT. Whereas for diffuse otitis externa, the approach varies depending on its type, like bacterial diffuse otitis externa usually needs oral antibiotics plus antibiotic ear drops or ointments. Fungal diffuse otitis externa, or otomycosis, requires thorough ear canal cleaning to remove the fungus by an ENT, followed by a prescription of antifungal ear drops to eliminate the remaining fungus. Diffuse chronic otitis externa is treated with a combination of oral antibiotics and external cream. Both fungal and bacterial infections can coexist, making the treatment complex. In fact, swimmer's ear, or chronic otitis externa, is usually caused by both bacteria and fungi when chemically treated swimming pool water enters the ear. Due to this mixed infection, treatment must be tailored to each individual. Doctors typically prescribe oral antibiotics along with topical creams that combine an antibiotic, an antifungal, and a mild steroid. Antibiotics can be administered both orally and topically, whereas antifungals is typically applied as a cream only. So, any ear canal infection needs to be properly diagnosed and treated by an ENT. 3. Inner ear infections, otitis interna. Inner ear infections are rare, but it is a serious infection that requires more aggressive treatment. Infection cannot start in the inner ear. It generally spreads from adjacent places to the inner ear. Usually, the root cause is a middle ear infection, which is, in turn, a secondary infection. In rare cases, the root cause could be brain infections like encephalitis and meningitis. So, determining the root cause and fixing it is also an important step in the treatment. The inner ear infection is specifically treated with high doses of antibiotics and steroids to control the infection and prevent complications. Additionally, the eardrum can be damaged by ear infections in the middle and outer ear. If the perforation or the rupture in eardrum is less than 3 months old, then doctors try to fix the infection or infections present, and then wait to see if the eardrum perforation is healing at a good pace. If the infection is not healing at a good pace, or the rupture is over 3 months old, they generally go for tympanoplasty, a surgery to reconstruct the eardrum, as the exposure of the middle ear to the environment can cause permanent damage, which could need additional surgeries or could be irreversible. In summary, every ear infection is different. Every ear infection needs proper diagnosis. Each requires a tailored treatment plan given by a doctor. The treatment plan also depends on when you are treated. The earlier you treat, the easier the treatment plan is, and the simpler the problem. As you delay the ear infection treatment, the issue can get complex and worse. The damage could be irreversible. So, if you experience ear infection symptoms, don't ignore it. Consult an ENT doctor to get the right diagnosis and treatment. To know more, please read our article, Ear Infection Treatment. Link in the description. Stay healthy. Stay happy.